Allergic problems, bronchial asthma, chronic bronchitis are now the commonly occurring health problem in every part of the world. Those have multi-etiological factors like exposure to dust, pollen, secondhand smoke, faulty diet habits, food allergens, chemical irritants, pesticides, temperature intolerance include cold air, emotional factors like extreme emotional arousal such as anger or fear, extreme stress level, etc. Even certain medications can trigger chronic bronchitis and asthma. Besides the external stimulatory factors, the immune system also plays an important role in manifesting the symptoms of allergy and asthma. There are many things that enter our body that our immune system usually views as harmless. But in a person with allergies, the immune system by mistakes looks at these harmless substances known as allergens as a potential threat and starts reacting. So how we can define those allergic persons whose body immune power reacts vigorously to the harmless substances whereas the same immune power in another non-allergic person does not react? How we can differentiate an allergic person from a non-allergic person? What are the things present in an allergic person that differentiate him from a non-allergic person? The answer is hypersensitivity. One allergic person is more hypersensitive towards certain allergens while a healthy person is not. One allergic person has excessive susceptibility towards some particular allergens which are harmful to that person whereas harmless to the healthy one. Types of allergy. Many health disorders are caused by an allergic reaction. The most commons are given below. Allergic bronchial asthma. It is the common chronic inflammatory disease of the airways characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchospasm. Symptoms include wheezing, coughing, chest tightness, and shortness of breath. It is triggered by various allergens or irritants. In allergic asthma, when the airways come in contact with an allergen, the immune system reacts and releases chemicals. These chemicals cause the muscles around the airways to tighten. Inflammation, swelling, and a buildup of mucus in the airways cause further narrowing. Allergic rhinitis. Allergic rhinitis is an allergic inflammation of the nasal airways. It occurs when an allergen, such as pollen, dust, or animal dander, particles of shed skin and hair, is inhaled by an individual with a sensitized immune system. It causes sneezing, itchy and watery eyes, swelling and inflammation of the nasal passages, and an increase in mucus production. Many of the same factors that trigger allergic rhinitis can also trigger an allergic bronchial asthma attack. Urticaria or hives. Urticaria, or hives, is a kind of skin rash notable for pale red, raised, itchy bumps. Hives is frequently caused by allergic reactions, however, there are many non-allergic causes. Most cases of hives lasting less than 6 weeks, acute urticaria, are the result of an allergic trigger. Atopic dermatitis. Atopic dermatitis is a type of skin rash. The term atopic refers to a tendency to develop allergy conditions, and the term dermatitis means swelling of the skin. Atopic dermatitis is often referred to as eczema, which is a general term for several types of skin inflammation. People who live in cities and/or dry climates may be more likely to get the condition. Atopic dermatitis usually develops in early childhood and continues into the teen years, but it can affect people of all ages. Pathogenesis of allergy. Our body's immune system is designed to recognize and attack any foreign particle or protein that enters our body. There are many things that enter our body that our immune system usually views as harmless. But in a person with allergies, the immune system by mistakes looks at these harmless substances known as allergens as a potential threat and starts reacting. This is where the allergic reaction starts. The cascade of allergic reaction is like this. Lymphocytes are white blood cells that play a key role in both immunity and allergy. They are divided into two types, the T lymphocytes, T cells, and B lymphocytes, B cells. The B cells produce antibodies like IgE to help destroy foreign substances when stimulated to do so by the T cells. Once the IgE is produced, it specifically recognizes its allergen and will recognize it on future exposure. Mast cells and basophils are the next key players in the allergic cascade. Each mast cell has over 100,000 receptor sites for IgE, which binds on their surfaces. The binding of IgE to these cells acts like the fuse on a bomb. Each mast cell and basophil may contain over 1,000 tiny packets, granules. Each of these granules holds more than 30 allergy chemicals, called chemical mediators. When a sensitized individual is exposed to the specific allergen again, the IgE is ready to bind to this allergen. When this occurs, the mast cells and basophils are activated and explosively release the number of chemicals from their granules that ultimately produce the allergic reaction that we can see and feel. Wherever these chemicals are released in the body will display the allergy symptoms. The most important of these chemical mediators is histamine. Once released into the tissues or bloodstream, histamine attaches to histamine receptors, H1 receptors, that are present on the surface of most cells. This attachment results in certain effects on the blood vessels, mucus glands, and bronchial tubes. These effects cause typical allergic symptoms such as swelling, sneezing, and itching of the nose, throat-free articles, and roof of the mouth. The peoples who have an allergic constitution have a hypersensitive immune system that initiates the production of more IgE antibodies. Homeopathic allergen immunotherapy. Homeopathy modulates the hyperactive immune system to a normal functioning immune system, thus gives a long-standing curative effect in allergy. Homeopathy can improve symptoms and reduce the long-term medication needs from any system of medicines. Homeopathy oral medicines along with homeopathy nebulizer developed by Dr. Satapathy at Multicare Homeopathy gives immediate effect to control the allergic symptoms in acute condition. Homeopathy can potentially prevent the development of asthma. Homeopathy can potentially prevent the development of new allergies to different substances. Homeopathy has the potential to help prevent the progression of upper respiratory tract allergic diseases to allergic asthma. Do you know that with the use of stem cell therapy you can cure diabetes and kidney disease from the comfort of your home? To know more about stem cell, check in the description. Please subscribe, press the bell button to our YouTube channel for more health-related topics. Thank you.